somebody talked about the causes of tingling feeling in the left part of the breast, arm, and to the legs. Can it be the same estrogen, sir?
Yeah, it's the same estrogen. It's the same estrogen, and is the effect of the estrogen on the calcium lack. I deliberately did not talk about HRT because I expect that to come in question.
Yes.
Yeah, I expect that to come in question because, you see, if I talk about it, I mean, people might not remember what I said. But if there's a question about it, the tingling sensation is due to calcium lack, and the same thing, you have muscle twitching, muscle pain, and of course, bone pain. That is when it's getting to the severe end. And I'm sure some of us, we know Queen of England, Queen Elizabeth. And if you really want to judge her, you will feel she's lost up to a foot of her height. These are the things you get when you have osteoporosis from estrogen lack due to menopause. That is a typical example. And like I said, once the calcium is out of your bone, then you will not be able to replace it. And what you can do about calcium, not leaving your system, even not minding the bone, is at this age, there are tests you can do. When I say you do blood tests, they need to check your vitamin D level, because vitamin D is very important in your calcium absorption and metabolism. That at least will help you, because you don't just need calcium in the bone. You need it for the movement of your heart, the movement of the muscle, and the movement of even the blood vessels. Anything, anywhere you have muscle and it moves, you need calcium.
Okay, let me understand this, sir. When you said that calcium cannot be replaced
in the bones,
in the bones, so taking supplements with high milligrams of calcium and vitamin D doesn't help.
It does. Once you have allowed your bones to be lose their calcium deposits, so with that one, prevention is better than cure.
Wow. So this is why we should talk about things like this from an early age.
Yes,
so most
from
women
an early stage, you want to understand, yes. And that's why around the world, okay, sorry, around the world now, the test they ask you to do at an early age in their mid-40s is your vitamin D level. And then if they're going to give you supplement at all, they put calcium. Of course, in some parts of the world, they have fresh milk, which is a good source of calcium. So it's better prevented.
I still want to know, so the calcium that women are taking right now, because I take calcium, are you saying that it's not absorbed by the bones at all? I mean, by the body? And it can't affect any changes in the bones?
Okay, well, let me explain this better. The bone is such a hard structure that has some framework. It's like having a concrete whereby you have metal rods and things like that, and then they do the mortar and they put it inside. If, for example, the substance of the concrete, the metal rod is being removed, you can't put it back. I hope you get the message where I'm saying it's better you prevent the metal rods from being corroded.
Okay, so what can women do? Because a lot of women, from the various questions, they have body ache, joint pains, the bones are aching, the bones are creaking. So at this time, since there was no prevention, which is better than cure, what can they do now?
Okay, like I said earlier, your joint pain, your body ache, and things like that is not necessarily due to bone pain. It's due to the other aspects that depend on calcium. Your muscle movement depends on calcium as well. But it's just that once you start feeling the clicking sound from the joints and things like that, with that one, there's not much you can do, because the replacement of that is almost impossible. In medicine, you are taught not to say things are impossible. But like I said, prevention is better. You see, if this topic is well discussed, then people will realize that, oh, at a certain age, this is what they need to do, and this is what they need to be taking so that they can prevent. But I will say this, for the joy of us being blacks, overall, I think the blacks generally are known to have heavy bones. So we suffer less. There's a racial protection. We suffer less from osteoporosis like the Europeans. And of course, see, they tend to, I mean, when you look at obesity or even heaviness, I mean, it's commoner in blacks because we tend to have strong bones. That could be a racial protection. So if you take the medication,
good news. Thank you for that.
Yeah.
And now we have a question on what are the benefits and risks of HRT?
Okay.
I want to know especially because of my symptoms. I've had all kinds of symptoms. So I really want to know, and people have been asking that. And I also hear that a lot of Black women don't go for HRT. And we want to know why. Is there any risk? Is there anything that, within the African context that can affect us? We want to know.
Okay. I think the problem we have as Blacks, or let me talk about Nigerians, is we discuss a lot before we find out the facts about anything. People, we always know somebody who took it, who had this problem. But then if you try to find out who exactly was the person that took this medication or had this problem, and then somebody else knew, and then somebody else knew, you don't know. And I will start from this. I will ask us to go and buy Panadol and read about the leaflet of Panadol, what side effects Panadol can give you. Then you will not take Panadol again.
There are lots on it.
Yeah. So the same way, medication they have to write possible side effects. And for an individual, it depends on what you feel. There's one condition that happens to every human being, and that is pain. Nobody can measure pain. But when people have pain, all you need to say is, do you want something for this pain? And the person will scream, yes. Do you want an injection or you have tablets? And the person will say, no, I want this pain away. Give me injection. That is what pain is all about. The menopausal symptoms is an individual thing. You know how it's affecting your life. And then they told you that you need to take this hormone, the HRT. I must explain, this hormone is not the same hormone you take for contraception. This hormone is half metabolized. It's supposed to be milder. It's supposed to be something that your body had done. If you get the natural hormone, your body is all half metabolized. It's supposed to help with some of those symptoms that you have. You will find out everything we talk about is about control in the brain. Your sleeping center is in the brain. Your blood pressure center is in the brain. And if all those centers lack this hormone, everything will go awry. And you find out that the treatment of choice for menopause is the HRT, the estrogen replacement. But this is half metabolized. The common one, if I tell you, there's one that is very common. They call it Premarin. Premarin is Premarin, Premarin. And what it means is it's extracted from the urine of, originally, the urine of pregnant mice, which means is the placenta from the pregnant mice that is now pure, which means is metabolized. It doesn't have the side effects of the normal estrogen that you take for contraception. And of course, then we have to talk about the risk of cancer, the risk of this and that when you read all that. But I will tell you, millions of people all over the world take it.